Welcome to this comprehensive overview of antibiotics. We'll explore their classification, mechanisms of action, and examples used in clinical settings. Antibiotics are drugs that treat bacterial infections by killing or inhibiting bacteria. Discovered in the early 20th century, they revolutionized medicine and saved millions of lives. Antibiotics can be broad-spectrum, targeting a wide range of bacteria, or narrow-spectrum, targeting specific types. They can also be bactericidal, killing bacteria, or bacteriostatic, inhibiting their growth. Antibiotics are classified by their mechanism of action, such as inhibiting cell wall synthesis or protein synthesis, and by their chemical structure, like beta-lactams or quinolones. Cell wall synthesis inhibitors, like penicillins and cephalosporins, prevent bacteria from forming cell walls, leading to bacterial lysis. They are effective against infections like pneumonia and strep throat. Protein synthesis inhibitors, such as macrolides and tetracyclines, bind to bacterial ribosomes and prevent protein synthesis. They treat respiratory, skin, and sexually transmitted infections. DNA/RNA synthesis inhibitors, including quinolones and rifamycins, block bacterial DNA replication or RNA transcription. They are used for urinary tract infections, tuberculosis, and respiratory infections. Folic acid metabolism inhibitors, like sulfonamides and trimethoprim, block the synthesis of folic acid, essential for DNA synthesis. They are primarily used for urinary tract infections and certain pneumonias. Beta-lactams, including penicillins and cephalosporins, inhibit cell wall synthesis by binding to penicillin-binding proteins. They treat infections like pneumonia, meningitis, and sepsis. Macrolides, such as azithromycin and erythromycin, inhibit bacterial protein synthesis by binding to the 50S ribosomal subunit. They treat respiratory, skin, and ear infections. Aminoglycosides, including gentamicin and tobramycin, bind to bacterial ribosomes, causing misreading of mRNA and inhibiting protein synthesis. They are used for serious infections like septicemia and pneumonia. Tetracyclines, such as doxycycline and minocycline, bind to bacterial ribosomes and inhibit protein synthesis. They treat a wide range of infections, including acne, Lyme disease, and chlamydia. Quinolones, including ciprofloxacin and levofloxacin, inhibit bacterial DNA gyrase, preventing DNA replication. They are effective against urinary tract, respiratory, and gastrointestinal infections. Combination therapy uses multiple antibiotics to enhance effectiveness, reduce resistance, and broaden antimicrobial coverage. Examples include ampicillin with sulbactam and trimethoprim with sulfamethoxazole. Antibiotic resistance occurs when bacteria resist the effects of drugs that once killed them. Causes include overuse, incomplete courses of treatment, and genetic mutations, making infections harder to treat. Antibiotics are essential for treating bacterial infections. Proper classification helps in choosing the right treatment, and addressing antibiotic resistance is crucial for future health care. Let's discuss antibiotic stewardship and its role in combating resistance. Thank you for your attention.